Today I'm thrilled to have Dr. Brenden Cochran, like I said, join us today on what I think this is the official O3 Movie podcast. Dr. Cochran's expertise in areas like ozone therapy and EBOO and patient education makes him a respected voice in integrative medicine. So I'm really thrilled and happy to welcome Dr. Cochran. Thank you for joining us.
Oh, thank you for having me.
You know, I was telling people earlier that I've met you before around the world, well, in the US, in these conferences that I've been attending, because, and this is a spoiler alert, I want EBOO to be a part of this film that we're making. For those people joining us now, we're making a film about ozone therapy. It's long overdue, and we have just started production. We have a fundraiser going on. So EBOO is one of the things I want to include in the film. So I'm going to let you explain what EBOO is and everything else. But first of all, and I don't want to spend too much time telling people about your background. I'm going to link to your practice and everything in the show notes and the description and caption so people can learn more about you. So let's dive deep into right away into ozone. So before anything else, what is ozone and why is this an important therapy for people? Can you, in layman terms, tell us what ozone is?
Yeah, so I mean, I think when you dive into ozone, the more and more you look at it, I mean, the true definition of what ozone is it's 3 oxygen molecules, right? We take oxygen, which is essential for life, which is 2 oxygen molecules. We put energy into it, and we briefly make 3 oxygen molecules. And those 3 oxygen molecules, along with the 2 oxygen molecules that we get from when we make it through any machine, 95% of the material coming out of that machine is just O2, and like 3 to 5% is O3 or ozone. So really what we're using is we're using oxygen and ozone in our treatments together. And what it does is, I think the most powerful statement it does is it's a hermetic agent. Hormesis is like a teeter-totter, right? When we get unbalanced, we get stuck in one area, we get disease. But if the teeter-totter is moving back and forth, when we're exposed to different things in the environment, different stressors, we have health. And what ozone does is it helps regulate that health. When we get stuck, it can help take us out of those areas that we get stuck if it's used appropriately. Just like anything in life, water is essential as well. And if we overdo water, it becomes a problem for us. But if we underdo it, it's not well enough for us. So I think that's the easiest definition for me is I believe it is a very, very strong hormetic agent. It helps balance the body's functions.
Kind of like exercise, right? This is what I learned recently talking to Schallenberger and at the conference. It's like, it's something he calls it exercise in a bottle, which is a great way to call it, because I guess that same hormetic response. But Brenden, there's a question that I keep asking everybody, and this is something that really explains the mystery of ozone. To me, as a layperson, what is the mechanism of action that allows ozone to, let's say, from what I'm learning, it's like a Swiss Army knife. It could do so many different things that, correct me if I'm wrong, but I don't know there's any other therapy or intervention in medicine that can do what ozone does. For example, you can inject it into a knee directly and it would fix a lot of the problems that go on there. But at the same time, given as a systemic treatment, it can stop or deactivate any kind of virus. Like, how are these two things related? Because in a normal person's mind, there's no relation between these two things. Like, my knee is hurting and I have a virus making me sick. It works in those 2 areas and many, many more. So can you kind of explain why that is happening?
Yeah, I think the way I look at ozone, as you hinted at, is it is such a multifaceted delivery mechanism. We can use it in the blood systems. We can use it in different topical applications. We can use it in different insufflations and different body cavities. And we can even inject it, like you said, into a joint, into tissues. So it really has this multi-dimension approach, and I think that's why it's such an amazing tool. There's nothing else out there that really hits that many boxes at being a tool, which is why it's so fascinating and so critical as a clinician to use, because any other tool that we use in our toolbox, it usually has like one or two things that it does. But this one, you can use it everywhere. So what we often see is joints, for example, and how is it related to maybe a person having a viral issue? Well, viral issues or infections, we may not have that in the joint itself. Hopefully you don't, because otherwise that's a real big problem, right? But if you have a viral issue, most of you know, you get sick, and what happens? Your joints are achy, your muscles are achy. That virus is creating a distressor on your immune system. It's also lowering the most potent antioxidant in your body called glutathione, which is second behind water as the most common molecule or needed molecule in the body. And there's a lot of what's called cytokines, these chemical signals of communication with different cells, your red blood cells, your platelets, your white blood cells. And they go into a fury when they see foreign objects or foreign pathogens in the body. And that has an impact everywhere in the body. It has an impact on your joints. It has an impact on your digestive system. And it has an impact in the brain. You know this because if I have a bug in the system, what does your brain do to that? Well, these white blood cells produce a chemical called pyrogens, and they adjust the thermostat on your brain to raise your body temperature. And the reason we do that is so that more enzymes work readily. Your white blood cells speed up. It's just basically back to physical chemistry, you know, better mechanisms and better chemical reactions when you elevate temperatures. So what happens when we deliver ozone into the body, if we're using it systemically, it is modulating a lot of those responses if it's used appropriately. So it modulates, like you said, exercising in the gym. If used appropriately, it modulates upregulation of that glutathione or that antioxidant to sequester this excessive oxidative stress that's produced in a viral reaction. It also can modulate excessive cytokines. So the immune system's getting overstimulated with a immune response. Say you got COVID or the flu or something, and you're really ramped up. If using it appropriately, it can modulate or lower those cytokines so they're more appropriate and not out of control. Think about it as a fire that is controlled in your fireplace versus a fire that's burning your house down, right? That's a controlled immune response. But if it's burning your house down, that's an uncontrolled immune response. And we need help so it doesn't put you in the hospital, right? So ozone, when used, can control that fire and keep it in the fireplace, basically, and tamper it down so it's more appropriate. Now, if we inject it into the joint, maybe we're having degeneration of the joint due to oxidative stress. Maybe we're having degeneration of the joint because of lack of oxygen. Maybe we're having degeneration of the joint because we're not getting enough stimulus into that tissue for repair. And so all of those different mechanisms can happen when we put ozone into a joint as well. So we can hit the body in multiple different aspects to get different clinical responses.
I love that analogy of the fire. I'm gonna steal that. When as I'm learning along, you know, a lot of people ask me to explain what I'm doing, and you know, it's so wide. The range of what ozone can do is hard to explain, and I think isn't that the Achilles heel for ozone? Because again, is there anything in medicine that can act this way and do the same thing?
Not that I've seen. I have not found anything like that, and I agree. I think Dr. Frank Schallenberger made the same comment. There is nothing yet in medicine that I have seen that has so many mechanisms of action and is safe with
safety is another thing.
minimal side effects.
Yeah, well, how about if we talk about safety, because a lot of people want to, or maybe misinformed, or be scared, or something that's so simple.
Yeah.
Like,
Yep. Ozone, I think, gets a bad rep because they think of safety as it's harming the body. And there's different components of ozone. We have ozone in our high atmosphere, and it protects us from UV damage, right? It is a protective molecule. And then we have ozone in the lower atmospheres that's actually created by pollution, and that could be harmful to us if we breathe it into our lungs in excess or long durations of time. And let me explain that. So if you're breathing ozone into the lungs are going to have the largest issue because they have the weakest antioxidant system in the entire body. So anytime we get oxidative stress in the lungs, we can easily overwhelm our antioxidant system, and then we cause harm to the lungs. So one of the things we always tell people, don't ever breathe purposely straight ozone into your lungs. It's not safe to do. We need to modify the ozone to be able to do that safely. And I think that's the most harmful effect. The other harmful effect is really in the concentration and the dose. And it's crazy to me that people think, oh, well, everything is toxic and everybody needs to use this specific concentration, this dose for every single individual. We don't do that in medicine, right? If you come in with anything, you take a drug, for example, hopefully a smart individual or physician is going to calculate the dosage of that drug based on the body weight of the individual in front of them. And they're going to make calculations based on what is going on in their body chemistry. So if I have, for example, problems with my kidneys, I'm going to adjust the dosage that I'm giving a person. Otherwise, it could be toxic to a person. So we should think about the same thing when we're looking at ozone. Another example of this. If we have a person who has problems with their kidneys, you taking something simple like potassium or drinking too much water is now toxic for you and you need to adjust the dosage. So I think it is absolutely crazy that we think that all ozone is toxic and it must be dosed in this strategy for every single individual, and it doesn't matter.
Great. Yeah, from what I'm learning, dosage is a big deal, and I'm going to get deeper into this later on. But let's sort of start moving towards EBOO, because this is the focus and the topic today. And I want to give a shout out to people who are joining us from London. We got people from Germany, people from Arizona, everywhere. So welcome to the O3 Movie Podcast with Brenden Cochran. So this is a particular question that I have, because I remember my moment when I learned about ozone for the first time. But I always wonder, what was it like for the physicians and the experts that now practice this and know everything about it? What was it like the first time? How did you learn about this? Was it in school? Was it from a book? Was it from a colleague? Because to me, it's like the first love, like you can't forget it. And I remember the first time I, as a regular citizen of the world, not a medical professional, heard the concept of ozone therapy, and it blew my mind. And here I am today making a movie about it. So I can only imagine what it does to a medical person, or maybe it doesn't, like, because I guess more medical professionals should embrace this than they aren't. So how was it for you?
I mean, when I first learned of it, I was actually in school and I thought it was crazy medicine. I thought it was cowboy medicine. And just like everybody else, oh, this is a toxic substance. What the heck? Why are we giving this to people? Why would we do this? Oh, somebody put ozone up their butt. What kind of clinical benefit does that have? So that was kind of my first impression of it. I was like, this is nuts. No, it doesn't make sense. And this is coming from a guy who has a chemistry degree and biochemistry, heavily focused, so hardcore sciences from the University of Washington, and then going on and doing a graduate school degree, and then getting out of, at Bastyr and looking at things from an analytical perspective. I mean, my background, I was going into pharmacy school basically, so I love biochemistry, and here's what happened to me. I said, okay, well, there's a part of you that wants to keep an open mind. And I hope everybody does that. I think that's one problem we have in medicine is we always think that we know what is right, and we never listen to our intuition. And then we get to a point where we realize, hey, I need to open my box a little bit more because this isn't working. I'm just running into a wall, and this is stupid. So I think somebody opened my mind to that, a few ozone docs that are seasoned in the field. I spent some time with them in their clinics and was seeing some pretty remarkable results. Like literally people's knees would get injected and their pain would go away. Literally they would have chronic fatigue or Lyme or other issues that their story would be just amazing that you just wouldn't hear anywhere else. For the amount of effort and time that was used with ozone, it was so quickly. So that led me to curiosity, right? When you start to hear things, positive things, it's like, okay, well, this is no longer, witch medicine, quackery. Let's dive into the science. And I'm a guy that wants to learn mechanistically what's going on, why is it going on, why did this person have an adverse reaction, what could cause that? And constantly inquire, because here's the thing with science. Science is never perfect. Everything we do in science is theory, right? And theory changes. We learn new things every single day. So it is never concrete. And I think that right there is huge when we're looking at new tools that are developing and what is the potential and what do we know already. So I dug into all the science, and I read, Dr. Bochy's work, I read Dr. Schallenberger's work, I was watching, what people were teaching, and started to integrate it into my own practice and see amazing benefits. The first area I started really was joint injections and IV delivery. I mean, that's kind of the framework, the easiest way to get into it, and you're seeing people's lives change in front of you. That gets your attention to keep digging more and more and more. And this led to doing enough ozone and kind of picking apart and really digesting a complex chemistry into more simplistic ways that I had a lot of practitioners ask me, hey, when are you going to do a course? When are you going to teach us? And that is kind of what took off from there, developed into, oh, well, I guess I could do that. I mean, I've taught other topics, but I didn't know I was ready to teach, ozone. So sure, let's go ahead and do that. And that really led down the deep dive of constantly looking into ozone, constantly questioning things that we're doing and modifying it. I mean, optimally, what I'm doing every single year is I'm looking at how do I improve the outcomes of my patients. We're in an age of outcome-based medicine. So we're looking at tools, we're looking at trainings, we're looking at our steps, what step makes sense. And the better outcomes we can get, the more we help people and more we get the word out for people to tell other people, this is how I get improvement in my health. And that ultimately, that's the goal, is to impact as many people as we can and help them. And that's ultimately my mission right now.
And mine, my friend, because that's why we're making a film about this therapy. I think it deserves it. So here we are, and we're discussing EBOO therapy. That's the perfect segue. So let's dive right into EBOO, which is EBOO. And what is, in plain words, EBOO therapy?
It is a unique way of delivering ozone, oxygen, and having a degree of filtration. And we'll define that a little bit more, I think, in the future. But basically what we're doing is you're taking blood from a patient, from a arm or a leg or another device like a pick or port. You're taking it out of one area. The machine's kind of helping move things, so nothing ever goes into the machine. And you're using this line, and what's happening is oxygen and ozone are contacting the blood constantly in small amounts, and it runs through this dialyzer device, and the dialyzer allows passive diffusion, so things move passively from a high concentration to a low concentration, and so, most of that is ozone and oxygen into the blood. And then that is returned to the individual through another vein. And that is done over a course of time. And that's literally what the process is of using EBOO. It's a distinct way of delivering oxygen and ozone to a individual.
Now, what would you say is the main difference from other forms of ozone therapy?
The biggest difference I see is it's a closed system and it's continuous. So you're constantly delivering ozone. It's not you're taking blood out and then you're just delivering a certain amount and then you're delivering it back in. And it's like this pulsed strategic way of delivery. The other thing is it massively increases surface area. So conventionally with major autohemotherapy or multiple passes, which is multiple major autohemotherapies, we have this volume of blood and you're basically putting oxygen and ozone into this big bolus of blood, right? In EBOO, we have thousands of these little filaments, and these little filaments are where the ozone and oxygen passes through, and it massively increases the surface area, so the blood moving by those filaments can have increased contact with ozone and oxygen. So it's not just bubbling through and contacting some of the cells or some of the material. It's getting a higher efficacy of hitting multiple cells at the same time going through this process. And I think that's the biggest difference, along with the dialyzer that is used is one mechanism, one dialyzer of renal dialysis. So we're not doing dialysis, we're not doing plasmapheresis where we're separating blood components, but we are using one dialyzer / filter that is having some impacts on removing things from the person, which is not seen with other delivery mechanisms in ozone.
Interesting. So, I mean, it sounds amazing. Now, are there any contraindications or anything to look out for? Because there's a lot of misinformation on the internet, and I'm going to get to that later on because that's a juicy part of the interview that I can't wait to discuss. But just for now, anything to look out for in terms of safety compared to other ozone treatments?
Yeah, so in order to move blood, we have to use an anticoagulant. So it's usually heparin or citrate in that blood. So if we have a patient or an individual who has really low platelets, that's a problem. We may not be able to do the therapy because our risk of having a bleed is higher. But this is, can happen in anything in medicine. We get concerned if the platelets get too low for surgery, for a procedure, if any of those, or not even having a procedure and you just have a bleed out event, that's a concern. So we look at that safety parameter to make sure they're adequate so that you're not going to have that issue. The other thing we worry about is, something called hemoglobin, which is in your red blood cells, which carries oxygen. Do we have adequate amounts of hemoglobin in the body? Because if we don't, then the therapy is not going to work as well, right? Because hemoglobin is what carries oxygen, and we're delivering oxygen to the person. And the other thing that can happen is some people during the process, you'll get a small decrease in hemoglobin if you're doing too high of a concentration, too high of a dose, or running it too long. So that's a safety precaution. And then finally, we look at things like electrolytes, because there are small amounts of electrolytes like sodium, potassium, calcium, magnesium that can shift a little bit during the procedure. And we want to make sure that an individual's not like borderline low or having something that they could have a problem during a procedure. And this is not, you know, to paint the picture, we do this extensively with IV nutrition. I mean, when I teach IV nutrition, it's also a requirement to screen your patient. This is a safety parameter. This is to make sure that we don't have surprises. Now, 95% of the time, most people come in, there's no issues with their labs. It's totally safe to do, but you want to pick up that 5% because you really don't want to learn that while they're in the chair, right? I want to learn that ahead of time, be a good doctor, and screen for that, not be an idiot doctor and be like, oh my God, I don't know why you're having an adverse event. Why is this happening? That's the practice of medicine, is making sure any procedure we do, you work up the patient or the person appropriately to make sure they're going to have a positive experience and not have an adverse event. So I think those are the biggest things that we look for safety. The last one that I think a lot of people don't understand, and this is ozone in general, is there are certain things, medications, even supplements, we don't want a person to take a large amount of before any ozone process. These are things like vitamin A. These are things like retinols. They have a unique property of what's called an alkene. Here's my chemistry brain, right? And if you look at the biochemistry or the organic chemistry of that, when you take an alkene substance that is saturating the blood and you apply ozone to it, it's an oxide, right? It makes something called aldehydes. Aldehydes are bad. If you want to learn what aldehydes are, go get some really crappy wine or beer, drink a lot of that, and you'll feel how crappy you feel the next day. It's like a dump truck ran you over multiple times. That's an aldehyde, right? And we don't want to have that variable in anybody who's getting ozone come out the other end and say, man, I feel crappy. I feel like a dump truck ran me over. And the excuse I hear from most practitioners is, oh, it's fine. You're having a Herxheimer reaction. And I know, you just don't understand biochemistry, stupid. You gave them a substance and then you gave them ozone and you didn't understand why this happened. Most people, in my opinion, it's like when a patient has an adverse event, you need to track back and figure out why did they have an adverse event. Don't just blame this on saying you're having a Herxheimer reaction. The body doesn't just do that. That means you've harmed the body or you've exceeded the body's ability to get rid of a toxic substance. You've overwhelmed what I call, and one of my mentors told me, adaptive physiology, the ability to respond to a stressor. That is absolutely critical. And if we do a great job screening people, we can minimize those problems from happening.
That's great. Well, I wish a lot more people would talk about this because I have never seen anything being discussed outside of the medical conferences. I saw your presentations and other people's, but online, and you see a lot of sensationalist footage around EBOO. I'll save that for later. But there's one big aspect of ozone administration, which is dosage, which there's like two schools of thought in general, it seems, around the world. Low dose, high dose. When it comes to EBOO, is EBOO low dose, high dose? What is it?
If we're looking at dosage, we calculate dosage by volume and concentration. That's given, right? If we're looking at EBOO, it's technically, or multipass, or even MA, major autohemotherapy, most of the situations that I see other practitioners doing, they're giving high dose. Even EBOO is high dose, right? Now, the uniqueness that we're learning, again, medicine is a theory, and we're learning things, is the dosage, high dose in EBOO versus the high dosage in MAH or multipass. I believe there is something different there because we're giving different concentrations, much lower concentrations, at least you should be, with an EBOO process. And that low concentration is slowly slowly touching the red blood cells, the platelets, the white blood cells as they pass through. And I think this is a lot less traumatic on those cells, even though the dosage is high because you're doing this procedure for up to an hour and it's constantly, continuously adding a little ozone, and it's the volume that is very large that we're treating. I believe this is different. We see this clinically too, than giving multiple passes of a higher concentration of ozone in a smaller volume. That concentration is high, so therefore when it interacts with the red blood cells, the platelets, the white blood cells, they're going to react a lot differently to a high blast of concentration than a low blast. You're going to have more time for adaptation. Just like when you exercise, you know, if I give an appropriate amount of, say, a sprint, or I condition you to be able to handle exercise, you're going to get a positive response. If I overdo it and I say, you haven't exercised in 2 years, let's go do a 2-hour workout, it's going to overwhelm a lot of those pathways and you're going to feel absolutely terrible. And in the worst case situation, you've done something where you've overcome the antioxidant buffering mechanisms. And what ends up happening there is then this oxidative blast is too much for that specific individual. And what you see is the cells become unstable and they actually cause lysis of the cells. The cell membranes cannot tolerate this amount of oxidative stress. And so when we're delivering EBOO, it is high dosage, but the concentration that we're giving is very, very low. The other thing I want to talk about is when we're giving EBOO, it's very, very safe with the process, specifically because we're only taking out 150 mils of blood at a time. We're treating 3 liters of blood in a session, at least with the Stratus EBOO is set and calibrated for that. I can't vouch for any of the other devices because I haven't seen any good testing on it. But 3 liters is treated and only 150 mils of blood is outside of an individual. To give you reference to that, when you go in and give therapeutic phlebotomy or you donate blood, it's 500 mils of blood that you're giving. So it's much lower than that.
That's good because sometimes I posted footage of a session, an ozone therapy session, and I get responses like, "Oh my God, that looks scary," or you know, "I couldn't do that," and stuff like that. But I tell them, "Hey, it's less impactful than donating blood." Yeah, and that's a correct statement, right?
There's less blood used than donating blood.
Yeah.
Yes.
So it's pretty non-invasive, really. If you ever been you know, poked for any sort of injection, that's about it. I mean, I can speak for experience. Also, another thing I want to speak from experience that I'm really curious about, I don't want to get too technical right now, but it was thanks to you that I identified that I have a gene mutation that probably many people have, which is the SOD mutation that, and you just gave me the headline, so maybe you can unpack it briefly for us, but does having that mutation mean that I'm not a good candidate for high dose ozone, or how should I go about it? Because there's probably a lot of people out there that have that sensitivity or mutation, and they may not know. And how should they proceed?
Yeah. So you're referring to, it's called SOD, or superoxide dismutase, and all of us inherit this gene from our parents. Some of us have no mutations, some of us have one, and some of us are unlucky and get a double mutation. And when we have mutations on this, it lowers basically the functionality of that gene to express itself. And superoxide dismutase, what it does is it helps us break down oxides or oxidative stress that is caused. So if you're getting a strong oxidative treatment like high dose ozone, you're going to have problems because you can't deal with those oxides, right? Now, the cool thing is this is a gene. So it's like an address, right? We can still influence how the gene functions. If you ever read Bruce Lipton's work, and this isn't the tea guy, he has a book out talking about epigenetics, and this is well known since him even, that we can change how the genes express themselves by environment, supplements, diet, all of these things. The beauty of using ozone appropriately is that SOD mutation, if it's not working very well, if we know that, guess what? We start really, really small dosages or really small concentrations. Because then what we're trying to do is we're training upregulation of that SOD. Just like when you go to the gym to train your muscles. I want to enlarge my muscles. That takes work. Same thing we do with ozone. Now, if I do that really quickly, high dose, I overwhelm that pathway and I cause problems. And this is part of the uniqueness of, I think, the biggest thing, the other passion for mine is, besides tools, is proper evaluation and precision-focused medicine for patients. Each person in front of us is unique. We don't treat them like a number that you might see in like a hospital, right? You come in, everybody's treated the same way. We don't do that with ozone as well. It's a tool, and you can customize the tool to get the best outcomes, and that is reliant on your practitioner doing a very good workup, not just slapping you on a machine. That's stupid. It's kind of like the same thing I see with people taking supplements. Why are you taking a supplement? Well, I'm taking this because I have this symptom. Well, that's no different than you taking a drug that's treating that symptom as well. So why are you using that supplement? Hopefully you're using that supplement to address something in your physiology so that it corrects the problem versus band-aiding the problem. And I think this is a dynamic that a lot of patients, they need to understand, that these are tools just like a contractor has a hammer, a screwdriver and stuff. And we need to choose the appropriate tools. And a very skilled practitioner is going to be able to sort through and say, this is how we're going to use this tool to get the best results. And with EBOO and ozone, we can do that. Yes, we can look at your genetics. We can look at different lab markers to see, just the cheap lab markers, $5, $10 lab markers, and see, man, you don't produce a lot of glutathione. You're more likely to have a problem with higher dose of ozone. We shouldn't start there. So very simple things that can customize the treatment to prevent adverse outcomes. And I think it's more of a lack of knowledge than your physicians purposely doing this. It's just they don't know better. They don't inquire about this. And so they miss key things in evaluating the patient that could make a better experience. And instead, they don't have an explanation for why the person has this, and they've heard so many times, they're conditioned. Conditioning is a terrible thing. We just think we got to do this same thing every day. So what they do is they say, well, you just had a Herxheimer reaction. They just blame this again on some Herxheimer reaction. I'm like, no, it's not. It's something went wrong, and you need to figure out why it went wrong, and don't do it again if it happens.
Love that, because I think that's very important. When something starts to trend, it kind of gets out there too fast, and there's a lot of these issues that are not being addressed. And me as I'm a regular guy, but I'm a biohacker, and I'm making this film, and I get to go to places as a regular guy that most regular people don't get to go, like the conferences. And what I learn there, what I see, concerns me, because I see a lot of fashionable stuff going on in these like express clinics or IV lounges, and we're doing this, we're doing EBOO, but I'm like, do you guys know anything about this? It's fantastic, but hey, there's more to the story, and I think we have a responsibility in educating people, and this is what I'm doing right here. So just for people out there that are not medical individuals, what can you tell them EBOO can do for their health. So just give me the A to Z on the conditions and the things that EBOO can help them with, so that this gets out there.
I think there's two categories we have of people. There's proactive health, and this isn't preventative health. This isn't like, oh, if I don't get a colonoscopy, bad things might happen. This is proactive health. I want to age more gracefully. I want to have energy. I want my mind to keep going. That's proactive health. So we got proactive health where EBOO focuses. EBOO is basically delivering, again, oxygen and ozone. And remember, hormetically, we're trying to prime the body, right? Upregulate antioxidants, give oxygen to the system. We can improve oxygen delivery to cells, and in the process, we can get rid of some junk through the dialyzer, right? Filter, capture some things, which every single day we're exposed to crap in the environment. Well, and even our natural metabolism, we make extra crap, right? So we can use that as a proactive maintenance strategy. So I do that myself. Every quarter, I get myself an EBOO treatment just proactively with my health, okay? If we're trying to prevent cardiovascular disease or cancer, which are the top two killers in the nation and the world, I want to be proactive, and in order to prevent those from happening, I need to reduce my burden of toxins, I need oxygen, and I need my immune system to be functioning properly. And I need antioxidants to protect me from oxidative stress in the environment. So that's what I mean by proactively doing things. Then there's the retroactive medicine. This is what most medicine is. Oh, crap, we have a problem. Now let's address it. But this has been going on for 20 years. You just didn't know it, right? And I call it, reactive medicine. This is where now you have a chronic disease. I have heart disease. I have dementia. I have cancer. I have Lyme disease. I have mold issues. And in this process, what we're using EBOO for is to help, again, improve or strengthen the immune system function, get oxygen to cells so that they can improve their energy production. We can also help remove some of those toxic materials out of the person as well. And all of these things help reduce body burden, but improve functionality of biochemistry. And so it's a tool, along with other tools, that can improve that outcome. Now, your outcome is much better when you use this tool with other things. So in the biohacking community, we know, there's a lot of different tools out there, right? So if you use one thing, you're going to be, cutting your legs off. It's not going to work as well as if you pair it with other things. So we always pair EBOO processes with other treatments to get the best results. But those are kind of the two categories that we
What
use
about
EBOO with.
conditions? Like, give me names of conditions that this could be, that you've seen is helpful for.
Again, Lyme disease patients, post-COVID, either vaccine injury or COVID where they've had COVID without a vaccine and they're still having issues. People with cardiovascular disease, I've seen it extremely helpful in doing several tests and then putting them on this process and noticing improvement of their cardiovascular functionality or their endothelium and potentially reduction of plaque formation in their arteries, carotids, or brain. Improvement in, again, dementia, so memory issues, brain fog issues is what we're seeing for this as well. And then a lot of toxicity issues, so accumulations of metals, molds, other things in the body that we're struggling with that are causing chronic fatigue, pain, chronic pain issues. All of these are just conditions that we see this tool can be extremely helpful in.
Fantastic. Yeah, I wish more people knew about it. Well, that's again why we're making a film about this one therapy, because what I've learned as a journalist and filmmaker is absolutely mind-blowing. And also it sort of troubles me, or it makes me frustrated, to see how this is sitting somewhere between established medicine and some unknown medical field, in a unjust way. However, the patients that discovered this, I call them medical refugees. There seems to be a subset of the population of people with health problems that are abandoned or are lost.
Yeah.
They're abandoned from the medical establishment. Nobody has answers for them. And these are the people who come and discover and get benefit, sometimes, oftentimes saved by this therapy. And in the way, they're the lucky ones. Now, why is it these people that are benefiting from this only and not everybody? Why isn't EBOO a known thing or widely available?
I think there's a lot of different tools out there, and EBOO is a powerful one. That what we see in medicine, because our focus in medicine has been so predominantly done on drug development and surgical procedures, and that we make it incredibly hard to get a procedure from point A to point B. It happens. I mean, for example, 15 years ago, you never heard of a gastroenterologist ever talking about probiotics, and now they're talking about it all over the place. Like they developed it, and it's like, no, guys, this has been developed a long time ago by your natural and biohackers. They found it. So what happens is a lot of these things are brought to light by patients that you just described by, hey, this is really helpful for my condition when nothing else is working. I didn't fit the box, right? And it takes a lot of effort to get that to mainstream medicine because it doesn't fit the box of, I have this condition, you treat it with this, or I have a hammer and there's the nail. And so it never gets brought to light in there. And instead of understanding something, we just say, oh, that's poo-poo, that's craziness. It's just like me when I was uneducated and I thought it was bogus, right? That's what we mostly do. Instead of saying, I don't know, we have our damn egos in the way that say, no, that's ludicrous. That's totally ridiculous. Instead of saying, I don't know. That's interesting. Maybe we should look into that. Maybe we should get curious. Medicine, unfortunately, we have lost all to intuition in medicine. We have been prescribers. We do not know how to diagnose worth a damn anymore. And we now basically live in this box and we say, you're crazy if you don't fit in that box, is what we brainwash our clinicians to do. And not everybody's like that. There are people that think, but a majority of the doctors that are coming out of school these days in the medical profession, I don't call them doctors anymore. I call them technicians. They follow a protocol and they never stray away from it. And that's why we have sick care medicine. We don't have people getting well because we don't have people that think anymore and investigate and get curious and use their intuition. And that's why a lot of these things like EBOO get stuck and hidden from everybody else. It's just they don't know about it and they think it's dangerous and it doesn't fit my box.
That blows my mind because in this day and age of communication, I know about this and I knew about this a long time ago. And I instantly responded to it saying, wow, this is amazing. Like, and I listened to a podcast just like this where they explained the whole thing. I was like, this is the best kept secret. Like immediately I started talking about it and look, many years later, here we are making a film. So, but I can't believe that as somebody who goes to study medicine that is still in that box. That's hard to believe in this day and age, but that's a conversation for another time. So going back to that, how would you respond, or I'm sure you do all the time, to skeptics who say EBOO hasn't been proven, or it sounds too good to be true. I don't know anything about it. It hasn't been proven. Well, what do you say to it?
Well, I say that, again, science is evolving and it's a theory. And the reason we found penicillin was an accident, right? And so what happened? How did we develop penicillin? Some guy in a lab accidentally dropped a mold on a bacteria plate and he noticed that it killed something. It was an accident. It wasn't science. It was a friggin' accident. And then it led to a discovery. And it took several years to get that from point A to point B. So when we're in the early stages of things, we need to understand that that's how science develops. We first develop by observation, and then we study it further and further and further and further and learn more about it. And then it becomes recognized as, okay, this is actually science. And that happens all the time. And I think we forget that if we look at the history of medicine is so rich and interesting. Of everything we've done in medicine is literally an accident, or we tried it and it wasn't proven, and then we just kept observing and studying it further and further and further, and then it became the mainstream. I mean, we have some crazy things in medicine. We used to think that we put leeches on you, right? We still do that, or we bleed you out and that would fix everything. We put we still do it. We put a nail in your brain to lobotomize you, and that's still standard of care. I mean, the things we do in medicine are absolutely crazy, and eventually some of them prove out and some of them don't. And that's what I would say to any therapy that is gaining traction or new. We just need to keep doing more and more research, and that's our mission. My focus is we need to take EBOO, keep researching it, keep learning more, and then keep publicating more and more and more. And unfortunately, and I think we're going to get to this, there's some people who are making the EBOO devices are not doing that. They're not doing their own research. They're not testing things. They're just making freaking bogus claims, which harms the industry. And that doesn't help. It's more, if you're going to make a claim, you need to do something, do a trial, do a lab, do a paper, try to get it submitted, and that's how eventually it gets into mainstream medicine.
Well, you just opened the door for my favorite moment and the question of this interview, which is exactly that. I feel a responsibility because of the conferences I attended, that where I learned a lot of the behind the scenes and information that I'm lucky to hear. And I want you to tell us, please, because I see a lot of graphic content about EBOO, very sensationalist, jars full of stuff, and sometimes blood. That is it supposed to be there or not? Like it's very sensationalist in a way, and I think it's irresponsible based on what I learned. But I will let you speak about that. But why? What's going on there when we see those images? Is this something good or not necessarily? And what are the precautions you would tell both patients and practitioners about that?
Yeah, so the reason you see it all over social media is it's sensational and sensational sells. I mean, just watch the news, right? The news, all they try to do is cause fear or sensational things to get attention. So I think that the clinics that are out there, these med spas, these places that are doing this and they're using it as more of a sensational look, what we're seeing is there's a waste container, right, that's part of EBOO, and it drops off the dialyzer. And we're seeing people hold up these waste containers with this bloody mess. And they're saying that, look at all this toxic material we pulled out of this person. The other one I've seen is, just disgusted me, is like an overflowing volcano of white foam coming out of the container, dropping onto the floor and saying, look at all this toxic material coming out of the person. You don't know until you've actually tested it. That's my comment. So don't make bogus claims. Now, what we've seen, you want to know what those foams are? So that foam that's overflowing, going all over the floor, what that is that's called excessive mechanical shearing, or an excessive reaction with too much ozone. So that means the pump speed is going too quickly, there's turbulent flow, and turbulent flow, if you have red blood cells, turbulent flow causes shearing of those red blood cells across the dialyzer. If you have a person who's using incorrect equipment that is not ozone resistant, there's a dialyzer that some individuals are not using the standard of care, CTA 1500 dialyzer, which is the only one that has the most ozone resistant. You're literally having interactions with ozone degrading the material and now causing toxicity to the cells. And what happens when you cause toxicity directly to cells? They die. So what you're seeing is that foam is mechanical shearing, lysis of the cells. If it's extreme enough, you see this pool of red, frothy blood. That is called hemolysis. That is literally your red blood cells popping and dropping into the bucket. That is bad medicine. That is not helpful. And the thing that we see clinically is if the individual is weak, has a weak vitality, not worked up appropriately, they get really sick after the hours. And the excuse that's provided to them is, oh, you had a Herxheimer reaction. This is great. No, you didn't have a Herxheimer reaction. You lysed a bunch of your blood and dropped it into the bucket. Of course you're going to feel like crap. You literally did a harmful thing. It's just like if you infuse sterile water into a person. That causes hemolysis. So a lot of these images, they're hemolysis. It's not EBOO safe. It's EBOO stupid is what it is. EBOO irresponsible. When you're seeing stuff being done like that, that means the provider in the clinic does not know what they're doing, or the manufacturer does not know what they're doing when they're educating the provider what is and what is not. It is the responsibility of the medical community and the manufacturer of the machine to make sure you're providing a safe machine. And if you want to progress medicine, you cannot make a claim unless you have substantial evidence. And there's only one company that I know of that is actually doing research, spending money to see what is going on. That's Stratus EBOO. That's the only company, not EBOO safe, EBOO bullshit in my mind. It is just Stratus EBOO. They're making claims without substantial research, without presenting information at academies that this is what is coming out, this is what is not coming out, this is what we don't know yet. And yes, it's not in a massive journal. That's coming. But in order to get to a big journal, you do small populations, 12 patients, 7 patients, right? You start off there, and then as you accumulate more and more data, you then eventually make a larger publication. It takes a lot of time and money to get to that point. But that is happening. It just takes time. But the unfortunate thing that's going on is there are other players out there that are taking advantage of the research and making claims that they're doing the same thing. They are not. They're not researching the same dialyzer. They're not researching the same pump speed. They're not researching the same ozone concentration. So when you get a treatment like that, you are not getting the same thing that is being presented in medicine right now. You are getting something else. It is not apples to apples. It is apples to grapefruits is what you're getting.
Yes, this is very important. Thank you for unpacking that. And in fact, I represent the audience and regular people who might see this, come across these graphic images online. What would you tell them as far as how can people discern or identify a properly trained practitioner or machine other than the O3 movie Ozone Directory, which is featuring a lot of the prominent doctors? How can a regular person, because I get asked this a lot. I say, I'm making a movie about ozone therapy. Everyone's like, where can I get some ozone therapy? And you have to be responsible and send them to a place or somebody who knows what they're doing. And from what we've seen or what you're saying, there's a lot of people out there going rogue and practicing these things. So what can a person look out for? when they say, hey, I want to try this therapy? 2 or 3 things that they can look out for?
Yeah, so one thing before that I wanted to make really evident. So concentration is everything. Higher concentration on an EBOO machine. If somebody is telling you we're going to ramp you up to 20 micrograms or 20 gamma or 40 gamma on an EBOO device, they are causing harm. I tell you, the research that we've done has shown that even 7 micrograms or 7 gamma is too high for most people doing EBOO. It's 3.5 or less, very small amounts, right? And this was confirmed years ago. Most well-known researcher called Dr. Bochy, right? He writes a book on the ozone. He said the best dose was between 3 and 4. And that's what we're showing now. It appears that he's right, too. We're confirming that. So anything above that is causing harm. So one thing I would say is, if you have a provider trying to convince you to go higher, that's a red flag, right? That should be one big red flag. The other thing is some of the machines, the provider, do they calibrate the machine? Do they use an ozone analyzer to make sure it actually is producing 3.5? Because we found that some of the machines out there may claim they're producing 3.5, but they're actually producing 14. And of course, that's going to cause harm, right? Are they using the proper dialyzer? So I told you it's CTA 1500 is the standard. If they're using something different, run them, because that means they're using the wrong dialyzer. They're going to cause you harm. If you're seeing images on their social media, if you're seeing them make claims of, oh yeah, you're going to see a lot of toxic, frothy, red blood cell like red stuff in your waste container, and you need to run. That means they're improperly trained. That should be clear fluid, no tinge to it, clear fluid. All right, that is also important. If your provider rushes you into EBOO like a used car salesman without doing proper workup or evaluation of you, that means that provider is not educated properly, and you should not be going there. It's going to cause you harm. You should be getting a proper evaluation before you're put on any ozone treatment, right? To customize your treatment, not just run you through like a car wash or a used car salesman. That's not appropriate. And then finally, you want to look for, have they gone the steps of, are they approved by the American Academy of Ozone Therapy? Do they actively participate in submitting research? Is the machine have somebody that's doing research out there? Is the company focused more on safety versus these extraordinary social media blends? Because most of the time, if somebody is doing that, they're trying to sell you snake oil. So if they're spending all their attention on, look at all this cool stuff visually, they're not focusing on the patient, they're focusing on more of a sales pitch for you. That is also a red flag to run.
That's a great list. In fact, I'm going to compile that list and maybe publish it, because we're doing journalism here. This is a movie that will show best practices and everything about ozone from A to Z, and we'll debunk all that stuff. It's my pleasure and my responsibility, I think, to amplify the voices of the doctors out there that I'm meeting and are becoming a part of this project. I thank everybody so much. We can't do this project without you, without everybody that's helping to make something that's unpolluted, uncensored, and true to the beauty and the core of what this thing is, which is fascinating and worth making a movie, believe it or not. So with that, what do you think about the O3 movie project?
It needs to happen, because it will get the reality out to people that ozone exists. Ozone is a treatment that has successful outcomes. It will alert the public that there are options and it's safe. It's just like any other therapeutic or drug. There is a safety parameter that it can be used appropriately. and it will dispel a lot of that BS. It will open the eyes of practitioners that are uneducated, basically. It will help patients get fuel to educate their practitioner of, you need to refer me to somebody that does this, or you need to learn this and integrate it into your practice. So by doing that, we get the word out, and that helps more and more and more people get well. And so we need a good movie, and I really, really support what you're doing, and I'm 100% in for supporting that this project gets done. And anybody who's listening to this, please support this movie. It needs to get done, and it needs to get done in the right way, not a sensational way of bad-mouthing ozone, which we see can happen. You know, anytime somebody else gets a hold of something and does it wrong, they want to make it sensational. That's what sells news, right? Make it sensational. We don't want that. We want real facts, evidence, safety, and real outcomes.
Perfectly put. It's none of that. And it's also not a commercial. So we're not advertising any company. We're not, doing any sort of influenced approach to this thing. It's real journalism. You'll get to hear both sides of the story. If there's even another side, I don't think there is, but we'll give them a chance to say it. And yeah, this is not an infomercial of any kind. So, and we're not gonna, skew it towards the dark side of things and the sensationalism like you're saying. Now this feels like farewell, but if you have another minute or two, I have a couple other questions for you. Can you stay on? All right.
Yeah.
Right. So this question, I don't know if you can talk about it or how much you can talk about it, but at the recent conference, Ozone conference, I watched your presentation and I learned a few facts about EBOO that blew my mind and I think are important to get out there, especially what the filter is doing. Is that something you can talk about publicly? Or,
yeah, I mean, so the dialyzer,
of microplastics
the CTA 1500 dialyzer, it is approved by the manufacturer to reduce beta-2 microglobulin. Beta-2 microglobulin is a known inflammatory molecule in the body. We track it with people that have active multiple myeloma or leukemic disease. But even if you don't have those diseases, you don't want a lot of that in your body. So that is an approved use of that dialyzer. The thing that we're finding with other things, and I think there's this deception of, a lot of people make these things like, oh, okay, it's not a true filter. Well, what is the definition of a filter, right? A filter is something that is removing impurities. It's removing particles. It's removing specific substances, right? That's really the definition of a filter. It's removing something. So therefore, if we're taking beta-2 microglobulin out, we're technically filtering, right? Even if you're using an IV with a filter, that's technically a filter too. It's making sure that we don't have precipitant or blood clots go back into the person. That's separating things out. So I want to dispel that because I think there's a lot of people, oh, it's not a filter. Yeah, it's not like your coffee filter where you're putting pressure on it to try to get your water through it. That's not what this is, but that's not the definition of a filter, dummy. A filter is removing substances. So that's what we're seeing. So beta-2 microglobulin is concrete. The company who made that dialyzer had to basically put that on the approval process. These other things that we're seeing are at the dime of the manufacturer. So they don't manufacture the dialyzers. It's just the company who's making the EBOO machine is getting curious, right? We're getting curious. We're doing research to look. So one of the things that I can share with you is we believe microplastics are removed from the body. The reason we say we believe is because it's really hard to test microplastics because they accumulate in the brain, in the heart, in your tissues, not in the blood. And we don't have really good tests for that right now for microplastics. So we believe, but ultimately what would have to happen is you'd have to, get a really good lab test and look at microplastics in the body, do a treatment on many different people and see if those levels drop. So what we do have is we do have a test done by Stratus EBOO. Again, the company actually did it. There's other companies out there, they haven't spent money yet on this, looking at bottled water running through the dialyzer, like a process of blood going through. And the main reason for this was not to make a claim that it removed microplastics, but it was actually to make sure that it was safe, that we weren't giving microplastics to patients, right, during the process. Because we know when you get a simple IV, you get microplastics from that bag. So we want to make sure you're not getting more microplastics during the EBOO process. And in fact, one of the surprising findings, again, the curiosity of doing research, is on the other end, there were no microplastics. Not the same level, but nothing. So that would allude to that it's helping pull those out.
At least from the blood, right? I mean, it's taking
at least from the blood. Yeah, it gives you an early indication of further research that needs to be done, but tells you that likely there is the possibility that we are reducing microplastics from the blood compartment.
Oh, okay. This is a very technical question. I don't know if anyone knows the answer, but so if something's in the blood, do we know how long it's been there? Does it mean I consumed the microplastic an hour ago? It's been sitting there for days. How long does the body take to put it in the brain or other places? Do we know anything about that? Because it's good enough for me to know that it's taking plastics out of the bloodstream, but is that because I just consumed it, or it's sitting there for a while?
That's a more complicated discussion depending on the type of substance. So if you just consume the microplastics, likely it's going to be in the blood still before it gets put into tissues. Just like if you started licking lead paint off a wall, most likely within that 72-hour window, a lot of it's going to be in the blood compartment first, right? With time, the body doesn't like stuff in the blood. It's kind of like when you have high sugars in your blood. Your body doesn't like to do that. It causes problems. So what happens with time, and this is a matter of days to weeks to hours, your body says, well, either I got to pee this out, poop this out, sweat this out, or dang, I can't get that out through those systems. So now let's get it out of the bloodstream. Let's put it in your bones. Let's put it in your tissues instead so it's not in the bloodstream. And certain toxins have different affinities for different tissues. So we know microplastics are having more affinities for like tissues, like heart, brain, in the lymphatic system. And we know metals have more of an affinity for going into your bone and your nervous system, for example. And then we know solvents and mold toxins and stuff, they have a higher affinity for going into your lymphatics and your fat tissues, for example. So those are different dynamics that we're kind of learning about the compartments. So once they're in the compartment, though, guess what? It's harder to get them back into the blood system so then they can be eliminated some way. And often this is where we're finding, and our colleagues who are doing research, that using other things with EBOO process improves those outcomes, because you need to move it out of those compartments for EBOO to then have an effective process of getting things out of the blood.
Great explanation. Makes a lot of sense. So let's see. I've been looking forward to learning more at these conferences that I'm going. There was another thing that was mentioned. I don't know if you can talk about it, but it starts with spike and ends with is that something you can talk about? A certain protein that might be, according to the study that I witnessed being presented, is being taken out.
Yeah, so one of our colleagues was there, and she did EBOO training, so she knows how to do the right one. She used the specific Stratus device that has the most research, and she took it farther. Her specialty is in long COVID issues. So why are people having problems after getting vaccines? Why are people having problems that didn't get vaccines, that got COVID a couple times and are having disease-like processes? So her mission is to figure out, how do I help these people, right? And one of the things that we're seeing, and this is not, you look up papers, we know this. One of the papers was just published within the last year, showed that some individuals will have spike protein found in their tissues for, I think it was up to 300 and something days, is what we know so far. It could be even longer. I mean, we're literally tracking this information. So you're replicating these spike proteins, and they're trapped in the tissues. And some people do not get rid of them very well. Their immune system doesn't get rid of them. It's kind of like microplastics, metals, all this other stuff. They don't get rid of them. And when they're in there, they're causing immunologic inflammation. They're stimulating inflammation and stimulating the immune system in a negative way. And we've been looking at different ways to try to get it out of the body. A lot of people have been. It's not just this one individual. But this individual at the conference basically showed with liquid mass spectrometry that if they induced autophagy is fasting, things like fistin or resveratrol, substances that induced cell, removal of cell waste or removal of dead cells. If we used a substance like that and then paired it with the EBOO, Stratus EBOO process, that, hey, look, liquid chromatography showed us that we had some spike proteins caught in the dialyzer. It is a small trial. It's a start. It's small, so it needs to be larger, but that's where we start with research. We start with small, and then we increase. So she's going to be publicating that very soon, but it's very exciting to show we have a possible direction of improving these individuals who are not able to get this out, just like any other toxic material. So I'm very excited to hear more about her research and support what she's doing and kind of keep tweaking the protocols for best outcomes, because nobody's done that before. It's been an assumption. A lot of biohackers say, well, if you take this, it removes spike protein. Well, show me a paper. Show me some science on it. I have not seen good science on that. The only other way that we've been able to look so far, and this is a trend, and it does not, unfortunately, until she showed that, we capture this stuff like she did, we were mainly gauging this on doing what's called a SARS-CoV-2 quantitative antibody test, which you can do with a lab, right? Simple lab, your common labs. You run that on yourself and you see how high is your antibody count. The higher your antibody count is, the more you're reacting to spike protein in your body. Right, and what we've been looking at with our colleagues doing proper EBOO, Stratus EBOO, that is EBOO actually safe, not EBOO stupid. Basically what we found is that a lot of patients, their antibodies counts will drop over time and then they'd improve, which indicated or alluded to something is going on. Either you're breaking down the spike or you're regulating the immune system, like I said, so it's not overreacting. That's really the data we had early. But now that she's done this and she presented this information, we have a better understanding of the mechanism of action of what's going on, that we are potentially, it looks like, capturing some of this waste and helping the body facilitate removal.
Well, that's exciting. I can't wait to learn more. Maybe we can interview her for the O3 movie. And you mentioned biohacking, so I kind of want to wrap up there on that note, because I have to confess, I guess, that I learned about ozone in the biohacking space. And and why is this important? Because sometimes when I have discussions with doctors who are not so open-minded as yourself, they say, what is a biohack? I don't want to hear about it, or they discount it. I say, not so quick, because it is a good communication tool that's amplifying your voice. Same thing I want to do with the film, because I learned about this thanks to a biohacking podcast. I did not learn it from my doctor. I did not learn it from my hospital. I did not learn it from TV. So watch out, because this is real. And I think, and there's a question coming, I think biohacking is something that's here to stay. So I wanted to get your opinion on what that is, and specifically with ozone. And some doctors may not like to hear about this. Most kind of actually do. But ozone is something that can be taken home and administered by yourself, because there's certain mild or easy ways of administering ozone that are not so invasive or dangerous in any way. All of which, my favorite one is the ozonated oils. And now we have glycerin in the space coming, which seems to be pretty amazing. For those people joining us now, we're discussing EBOO and now biohacking, and how ozone therapy, not EBOO, but ozone therapy and certain forms of it, can be used at home for people. So you have to take charge of your health. And this is one of the tools that can be used for that. And used at home, you can ozonate water. It's a great disinfectant. I mean, so what do you think about biohacking in general? And do you encourage people, as long as everything's safe and proper information is being followed, to do this at home, or be a biohacker?
Yeah, I think, the biggest thing is the biggest wealth you have is your health. So learning more about how do you make yourself healthy is critical. I mean, knowledge is power there. And I think biohacking, what you're doing is you're learning, how do I improve my health? And then, I think the more safe way to do that is, hey, this is what I've learned, this is what I'm trying, and then try to work with an educated professional that understands that from a medical's perspective. I think the biohacking community is bringing light to things that wouldn't have usually been brought to light. They move the movement. I think, the earliest biohacking, I would say, is what the food industry is basically, that was biohacking, and that was driven by women, right? Because they said enough is enough. We want gluten-free, we want these vegetables, we want this clean food. I mean, that was pretty much biohacking, and that was people driving the industry to say, hey, we want more healthy choices. We want more choices. And I think that's evolved into now looking at other treatments, light therapy, oxygen therapy, ozone treatments, giving ozone, rectally, hyperbarics, all these different things, methylene blue. And I think they all have the potential for helping an individual improve their health. But I think the one thing that has to happen is you have to understand really, really deeply what is going on in the body, why is this working, what is an appropriate dose. And I think that could be one of the areas that, biohacking, I think we bring it to light, and then we need to refine the theory a little bit more, and working with somebody who understands that science a little bit more might be able to help the biohacker refine the treatment so it's a little more accurate and has better outcomes. But I agree, biohackers are here to stay, because they're bringing light and they're pushing change. They're saying there are other options out there than just this option. And that's the same thing that happened in the food industry. There are other options out there than this food. So
that's so true. I love that. In a way, it's instinct too. Like, it's a little bit of common sense, which is not so common, but it's common sense. In fact, you make me go on a flashback and remember how I became a biohacker. It is literally, if I had to trace to the first moment when that was born inside my my brain, I think I was 13 years old, and I was in the kitchen, and I remember my brother, who was, I guess, following some trend or something, was making brown rice, because at the time that was, the macrobiotic and stuff. And then he pulled out this bottle of water that wasn't so common. We're talking about the 80s, and I'm dating myself here, but. And I said, "What's that?" And he said, "Oh, this is mineral water. This is spring water." And I said, "Oh my God, I want that. I I gotta do this." And I guess, emulating my brother, I I said, okay, I'm going to drink this. And from that day on, and this is not exaggerating, I stopped drinking anything else to this day, many decades later. I have not touched Coca-Cola, anything but water. And I guess that's from early on. I had this instinct of following what seemed to be good for my physiology, I guess. And then it became mind, body, and spirit. So that's how I became a biohacker, if
Sure.
you're curious to know.
I think it's curiosity and science about how do I improve my health, and not necessarily trust that somebody else knows everything, because nobody knows everything. You're just trying to put pieces together. And even myself, I don't know everything. I try to learn a lot of stuff, but I learn from my patients every day, and I try to keep an open mind of, does that make sense or does that not make sense? And I think there's a lot of things that biohacking we're trying to bring to evidence that, hey, there are ways, like you said, the spring water. You know, I had a conversation with a patient earlier this week who's in her 30s who has ovarian cancer, and she had no idea that the tap water she's drinking, has high amounts of arsenic, PFAS, all these carcinogenic agents. You know, how is that legal? And I said, because they have a threshold they have to meet. But, you know, it's safe to drink at that moment, but if you consume this over 15 to 30 years, it's not very safe for you to drink. And I think that's the thing that people, if they are in the biohacking or health situation, they constantly are looking at ways to improve their health, because I'm sorry, the man out there does not have your back for your health. You are responsible for your health. They don't have the time for that. They don't have the resources for that. You are responsible for understanding, researching, and looking for the experts to help you with your health. Because if your health is gone, you're poor. You can't do anything. It is the most valuable asset you have is your health.
No question. So the statement, be the CEO of your health, is so true. I don't know who coined it, but I think that's very true. And that's what I tell people that they should look at and try to aspire to. So Dr. Brenden Cochran, it's been a real pleasure. Where can people find you if they want to talk to you or come see you at the clinic?
Yeah, so I have a few different areas. My clinic is Integrative Health Clinic. I'm up north of Seattle a little bit. That's my brick and mortar clinic, but I also work with several other clinics around the country, and I have one I work with actually over in London too. So some people find me for other doctors, trainings. If they want to find me, I have a website called drbrendencochran.com. And that's where most of my education material, trainings, consultations with other physicians who are trying to get educated go through. And most of my patient care, again, goes through my clinic, Integrative Health Clinic. So those are the two big areas that people can reach out and find me.
I hope they do. So here I'm gonna wrap it up. I'm gonna say a few words, but then I'm gonna pass it on to you to say the final words, whatever you want to say. But just for people out there, there's a therapy called ozone therapy. It's completely, absolutely safe if done the right way. It's amazing. It can change and probably save your life or somebody you love. So that's why we're making a movie. We wouldn't be making a film about a single therapy if it wasn't something very important that the public needs to know. And it's not going to happen any other way, because that's, the powers that be keep these things underground for very unfair reasons. So here we are. So if you hear of ozone therapy, open your mind, trust it, and come looking and learning about it. So Brenden Cochran, thanks for coming and giving us your knowledge and expertise. It's a real pleasure. I hope we can talk again soon. Whatever you want to say to the public, go for it.
Yeah, thank you. And I commend this project. Thank you again, Luciano, for having me on here. Ozone therapy is a very, very important tool in your treatment toolbox to getting your health outcomes. And I agree 100% with what you just said. It is a very safe tool if used appropriately in a well-trained provider or well-educated provider or individual. I would highly, highly, highly recommend utilizing this somewhere in your active or proactive health approach for the best clinical outcomes for your health.
Awesome. And thanks everybody for joining us. It's been great, real pleasure. And you'll see some of these clips later on. If you missed it, we'll be there and it will be on the O3 movie page. Thanks, Brenden. Have a great day. Go heal some people and help the world. And we appreciate you. Thank you.
Thank you.
Adios.
Bye-bye.